My name's Kathy Schilling. I'm a radiologist and medical director of the Christine E. Lynn Women's Health and Wellness Institute at Boca Raton Regional Hospital. We do screening as well as diagnostic ultrasound, breast MRI. We do positron emission mammography, and we provide biopsy services for all these modalities. So we've grown to identifying about 600 new breast cancers every single year, and we see at least 45,000 visits per year from women from around our community. So we've grown to really become a place well known for comprehensive breast care. Several years back, we were in need of new ultrasound equipment. We had entered end of life for several of our units, which were standard breast imaging units that a lot of people use across the country. And I had the opportunity to learn about the Aixplorer as a new piece of equipment, new technology, and we actually put the unit down in our ultrasound biopsy room. We figured we'd have the greatest chance in that location to analyze multiple different breast lesions, which were going to subsequently undergo biopsy. We were interested not only in the grayscale imaging that's provided by the Aixplorer, but also the shear wave elastography. We had worked in the past with elastography with other vendors and really were so disappointed in reproducibility. We could never even really interpret the image to know what they meant. I was really not a fan of elastography before I was introduced to the Aixplorer. So we put the unit down in ultrasound. We actually used the Aixplorer as the guide for our biopsy, so we could look at the grayscale imaging and see how beautiful it was, but also get information about the stiffness of the lesions and the tissue around lesions, and see how it correlated with the pathology, which we would get the next day. And we were surprised that there was tremendous correlation, and there was reproducibility, and there was ease of use of the equipment. The technologists loved the equipment. We could see the needles traversing the breast tissue just beautifully. The fine detail that we saw with the grayscale imaging was just really amazing, unlike any other type of breast imaging ultrasound equipment that we had ever seen before. You saw fine detail from the skin all the way through the subcutaneous fat and the postglandular fat and all the way to the chest wall. And in every patient, you could really see fine structures like the Cooper's ligaments and the ductal structures behind the nipple. And it was really just a huge step above anything else that I had ever seen in breast imaging before. And even I would get calls as we sent our images out to physicians in the local community who were taking care of patients who had their imaging done on our Aixplorer. They would call me and say, "What is this unit? Where can I?" It's just remarkable. It's so much different than the typical breast ultrasound. And so not only with the grayscale improvements, but also the addition of the shear wave elastography, we really found that it was something that we needed to implement throughout the center. Currently at our center we have 8 radiologists that are dedicated to breast imaging. And what was nice about having it in biopsy is that they all got to see and experience just how well this tool worked. And so not only did we have buy-in from myself, but from all of my partners, which to me, when you're making decisions, as a leader in a big group like this, we need to have buy-in from everyone. But it was also the technologists that said, "Oh my goodness, this is just so nice. The platform is small, the footprint is small, the ease of use of the keyboard, just very simple to learn," and everyone bought in unanimously without any push at all from me or from anybody else. So the 3 reasons that I would recommend the Aixplorer to other people interested in ultrasound is, number 1, is the platform is the latest and greatest technology, the future for ultrasound. It will not become obsolete in the future, even if you add on additional services. And I'm going to be able to use the same platform to expand our ultrasound services to include all women's imaging, abdominal imaging, pelvic, thyroid, carotid artery assessment. Secondly is the superb image quality, which is unsurpassed by any other unit that I've ever seen. And third is the added bonus that we have noted in breast imaging with the addition of the shear wave elastography. And I think that the rapid imaging is going to give us this same benefit in other areas such as vascular ultrasound.